it was interesting because I didn't know Byron had the position he had as Buck's physician. When I owned the Swan Avenue Market many eons ago, I had met Dr. Anglin, Mikkel Anglin, who at that time was the Bucks physician. And Mikkel held that position for 9 years, I think. And I gave his office a call and told him who I was, and I was trying to reach Dr. Anglin. And the receptionist said, "Oh, he doesn't do that anymore." I said, "Oh, he wasn't the Bucks physician this year?" She said, "No, he gave it up last year." I said, "Oh man, what a year to give it up." So I found out it was Dr. Moran, and managed to reach him through the channels at USF, and he graciously has accepted to be our guest for the Zoom. Byron, I think you graduated from undergraduate from Florida.
Yep.
Florida, and then actually just graduated from USF in 2014. So I would think that you're probably one of the youngest team physicians in the NFL, if not the. He is head of the director of the Concussion Center at USF, where he is right now over on Del Mabry. And he has a specialty in orthopedics, although doesn't do any surgery, just does consults, sports medicine, and internal medicine. So it's quite a resume for a young physician. But I thought it would be exciting to have him speak and tell us just about what a year it was. So Byron, the floor is yours, or the screen is yours. The floor is not yours.
Well, thanks, David. When David reached out and told me what he was putting together, I was flattered to come and talk with you guys. Obviously, a group of retired physicians and everybody from different backgrounds. And I think sports medicine is one of those fields that it's a little bit of an unknown for a lot of people in terms of what it is, what it isn't, and what do we do during the day. So I thought it may be neat to share some of that with you guys, and then kind of in relationship with the Bucks. So yeah, as far as my background goes, I was at USF as a med student. I graduated as a student back in 2011, and then did internal medicine residency until 2014, and then took a sports medicine fellowship from 14 to 15. And I've been on faculty here since 2015. And so the way a lot of that works with sports medicine fellowship is we train our fellows in kind of being the team physician for athletes, as well as being able to handle like non-operative orthopedics and concussions and things like that. So part of our role with athletics is sort of the primary care physician, so to speak, for the team, where you're kind of responsible for their care and whatever scenarios come up. And then you work with a lot of consultants, like, orthopedic surgeons obviously play a big role, and we work with them quite a bit, but they'll focus obviously on the orthopedic injuries and things that need surgery. But for us, it's anything from, the flu to this year, COVID, to concussions, to STDs and rashes, and my wife's sick and my daughter's sick, and it's kind of, you really take care of the whole team, the coaches, the players, and really the whole organization. And so it's essentially like a concierge medicine job where you're just kind of expected to be, available all the time when you're doing that kind of work. So as far as, my career, like I said, I started at USF at 2015. I kind of had some lucky timing. When I came out of fellowship, one of the faculty that was teaching me during my fellowship left the university, and that opened up a spot to help out with some of the bigger sports like football and basketball. And so kind of in my first year, was able to work alongside Eric Corus. I don't know if any of you guys know him, but he's been the head physician there at the university for, I think, probably 16, 17 years now. So I was able to basically partner with him and start right away traveling with football. We would basically split games for road trips, and then kind of both cover home games where you're there doing that. So that was a really important experience. And in addition, took on men's and women's basketball as a big focus. And throughout all that, again, you're working with the team. If they go to postseason tournaments, you travel with them and take care of whatever comes up. And so I was basically plugging away at that, for about 6 years, and then, or a little over 5.5. And then in January of 2020, got a phone call from the Bucs organization, said they were looking to bring in some new people for the medical staff. And so I was lucky enough to get an interview for that. In terms of how that works, it's really kind of it's a little bit of reputation, and it's a little bit of people thinking of you, right? And so I think the way it worked for me is one of the outgoing surgeons was David Leffers, because he was retiring. You guys may know him. He's been in the community a long time, and he and I worked together a lot at the university. So I think he was nice enough to suggest that they look at me when they were doing their search. And I think that's how the ball kind of got rolling. And then from there, had to come in and interview with they have a person. His name is Greg Skaggs, and he sort of oversees the sports performance area. And he's actually a sports medicine physician himself, but doesn't practice any medicine for the team, just oversees sports performance. So I had to interview with him, and then also with the owners before being offered the job. And so that was how that part kind of went down. So that was in January of 2020. So at that point, I had no clue what I was getting into, because we didn't know what was coming in a couple of months. But so that was interesting. I think meeting with the owners was interesting. They were very focused. Their main, they had questions about certain scenarios and what I thought about things like players getting second opinions, or how to build better rapport with the players and the coaches and things like that. So, I just answered those in an instinctive way. But one comment they made during the interview process was that their whole objective back in January was to win the Super Bowl this past year. I mean, that was it. That was the only purpose. And they said, we want the medical care to be at a Super Bowl level. And they said, we know what that looks like, and that's what we expect. And that was basically the interview. And so, at that point, I could only say, I understand, what you're looking for, and just hope that I could, provide that in the end.
What exactly had they signed Brady by the time you were hired? Mm-hmm. No. But when they say we expect medical care at Super Bowl level, how did you interpret that? I mean, what does that mean to you? The best care possible, or you're going to do everything to bend the rules to keep somebody playing, or exactly?
That's a good question. Yeah, no, it was never anything about questionable medical care. I think what they were expecting is the responsiveness is really what they look for. And when I say it's like concierge medicine, I mean, that's basically what it is, right? They expect that if somebody calls you at 3 or 4 in the morning, that you're available and you're on it and you get things taken care of quickly. And I think a lot of that was coming from, they have a pretty old coaching staff as far as their average age goes. And a lot of what I end up having to do is not just take care of the players, but you have a lot of coaches that are in their 50s and 60s that have kind of normal medical problems that need to be managed. And I think a lot of where they were coming from was that perspective of making sure everybody's healthy, staying on top of what people need to do.
Gotcha.
And it takes an understanding that it's not like a normal practice where patients are told to follow up and they follow up. It's much more hands-on, where it's like, hey, coach, remember, you need to do those labs we talked about 3 months ago. We need to do the follow-up on this and that. And so you really have to work closely with the coaches and really the athletic training staff to get all that kind of stuff done. If you kind of take the approach of, well, it's the patient's responsibility to follow up on these things, when it comes to coaches, that they'll never do anything until the off season comes around. That's just how they function.
Didn't Arians had some medical issues, didn't he?
Yeah, he's got a publicly known, personal history of different cancers and things like that. where they obviously want to make sure he's healthy and everybody else. And so I think that was kind of what they were looking for. I knew Dr. Anglin and Dr. Ramirez were the two primary care sports docs before me. And again, I think everybody always does their best. It's just, I think when a team goes through a stretch of losing, they start looking at everything. So a lot of times the docs can get caught up as sort of a scapegoat or a marginal excuse to just change something because they're looking to change things. And that can be as simple as it is. I think the doc that was with the team before those guys was Kevin Elder. And you guys may remember when the team had like an outbreak of MRSA infections, and he kind of got scapegoated for that, even though it really doesn't have anything to do, with the doctor. I'm sure all the players got treated for their MRSA, right? But the doctor's not the one doing the cleaning protocols and doing all that kind of stuff. So that happens, and that could happen to me at any point as well. That's just kind of part of the deal, I guess. So you do your best to make sure everybody's happy and taken care of and all that kind of stuff. But yeah, with the timing of everything, that was in January, and then by February I had to go with the team to the combine. So you're kind of jump right into the mix where you're helping out at the combine, and there you basically do medical evaluations of the players. Includes like a history and a physical exam and a cardiac risk assessment, things like that. Everybody does EKGs, for example. A lot of them will end up with echoes. And if there's anything questionable, there's even more like cardiac MRIs done. So all that stuff happens at the combine. So you're busy with that. And kind of my job with the combine stuff is to communicate to the team, and they use like a grading system of medical risk, essentially. And so this team uses like an A, B, C, D, F grading scale, where if you give somebody an F, you're saying just don't draft this person. They're at risk of being medically disqualified. So those are like your people with a cardiomyopathy or something along those lines. And then your A's would be people that are perfectly healthy, and D's are people that have higher risk problems where you're saying, you may want to rethink drafting this person because they could have problems in the future. So you basically communicate, but at the end of the day, the GM drafts who he drafts, and you're basically an advisor at that point. So that's how that part works. But shortly after the combine, that's when everything got a little crazy in more than one way, right? We had the pandemic kind of ramping up at that point. I was actually on the road with our men's basketball team, and we were in the locker room about ready to go out and play game one of our conference tournament. The guys were just starting to get dressed, and coach walks in and says, "Tournament's canceled, we're going home." And we were in Fort Worth at the time. So all that hit, and then shortly after that, they start going a little crazy with their free agent signings. And next thing I know, Tom Brady's on the team and Gronkowski's on the team, and it just kind of kept rolling from there. But obviously with the pandemic, I really didn't even see those guys until they got to the facility in like July, August timeframe for camp, because teams weren't allowed to fly players in to do physicals or anything, which would be what they would have traditionally done, in prior years. So it was interesting. As far as COVID goes, the NFL's different. Obviously it's $1 billion industry. There's a lot of investment in making sure that they're successful. And so they actually contract with a infectious disease group that sort of counsels the league office on guidelines and protocols and things like that. And so as the season got running, the NFL was rolling out a lot of these protocols that they were kind of being developed as they went about how we were going to handle COVID. And really everything was pretty unknown up until the last minute before players got to camp. I think we got the protocols like a week or so before camp started. It was everything was kind of stay on your toes and moving pretty quickly. Were there any certain questions you guys had? Just kind of use that as a stopping point that you want me to elaborate on or try to dive into further?
Brian, what was it like during football games? Were you at the sidelines, and when somebody was injured and they said somebody may have a concussion, did you run out there and get on the field and make a decision? Were you that guy?
Yeah. So, well, it depends. We all have roles. So for me, I'm the head team physician, which means I've got to sign off on all the protocols and be responsible. But it doesn't mean I make all the different decisions. And so the way it works for games is there's 2 primary care sports med docs, and there's 2 orthopedic surgeons at each game, road and home. And so, so part of my role on game day is I'm there usually about 3 hours ahead of kickoff. Guys start kind of rolling in, and I think everybody's expected to be in the locker room by 2 hours ahead of kickoff. And so obviously on the road, that's all done by like a bus transportation from the team hotel. And then for home games, they park at the stadium and show up on their own. So I get there about 3 hours ahead of time. And so I work with the athletic training staff, and there's a EMT that helps out as well. And we basically set up like an IV fluid station. A number of players will take IV fluids before the game to hydrate. And then we administer different treatments depending on like what's going on. So for example, if a player's got an injury, the surgeons may sometimes do an injection, you know, and again, it's never an injection in a joint that would pose the risk of injury, but it's not uncommon that you have like an AC joint injection, like if somebody's had a separated shoulder, and all you're injecting is basically like lidocaine and marcaine just to numb the joint for the game. But you would never do that to a knee or an ankle or anything like that. But the AC joint's sort of a unique joint. We'll use sparingly like Toradol injections if somebody's dealing with like a pain issue, you know, if they've got a sore back or a sore ankle or whatever it is, and they just need help with pain during the game. Toradol injections are still done, but they're not terribly common on the team. And then certain guys, like I said, will get IV fluids before the game. And so having the EMT on staff is tremendously helpful, because that was one of the first things as a sports med doc when I started covering sports. I was like, oh gosh, I need to learn how to administer IVs because everybody's expecting you to run the IV fluids in the locker room. And so it takes you a little while because you're like, man, when's the last time I put in just a regular old peripheral IV to do something like that? And so normally, like with the USF games, we don't have an EMT helping us. So me and Dr. Corus or whoever else is there has to do all that. But luckily with the Bucs, we have an EMT that's very proficient at putting in IVs. And so I just kind of help him out. I'm like his assistant with the IVs, play my role there. And then once we're all done with that, there's basically like a 60-minute medical meeting where you go out, you meet with the other team's doctors, you meet with the referees and all the other medical personnel that are at the games. And for the NFL, there's quite a bit. You know, there's usually a sideline, there's 2 sideline neurologic specialists that, and I'll get into that with the concussions. And then there's also like an airway management physician, as well as what's called a visiting team liaison, which is usually like a local emergency room physician that would basically facilitate things if the visiting team had a bad injury there or somebody that needed to go to the ER. So you meet with all those folks and just go over the emergency action plan and things like that. So that's kind of a nice opportunity to meet with everybody. So that happens about an hour before kickoff or exactly an hour before kickoff. And then once the guys are out going and they're playing, then yeah, we're basically on call. You know, we're there on the sideline. You know, for me, I just like to pace around and watch the game, try to get a view of the field to pay attention if anybody goes down. And so my big responsibility during the game is anything medical or anything head injury related, I would have to deal with. If it's an orthopedic injury, then usually that'll go straight to the surgeons to be evaluated for those injuries. So concussions would probably be the most common issue that we have to deal with during the game. And so for that, there's a whole protocol. So if a player goes down and there's suspicion for a concussion, you know, we bring them over. You probably see those pop-up tents on the sideline. You know, so we bring them into the tent, and it's both me and the independent neurologic person. And so I go into the tent and I lead the exam, talk to the player, do kind of a screening neurologic exam, and and see how they're doing, how they're feeling, if there's any impairments that we can tell. And even before we do that, we actually go to a monitor and watch the video of the hit that happened. So it's pretty neat how that works. You know, you go straight to this kind of camera station behind the bench. You put on this headset and you're talking to somebody up in the booth. And you say, let me see that last hit on so-and-so. And they pull it up and they give you all the angles so you can see, like, did they get hit in the head? Did they hit the ground? You know, was it something else? And then you go in and evaluate the player. And that's really helpful because players will always or almost always want to be back in the game. And so it's not uncommon for a player to say, oh, I just got the wind knocked out of me or something like that, to sort of brush off the fact that it took them a while to get up, or maybe they hobbled a bit. But part of what we're looking for on the video is the mechanism of the injury, but you're also looking for different, what they call no-go signs, which would be somebody appearing unconscious, somebody stumbling when they get up, or any sort of trauma posturing, you know, where you see like the fencing posturing or things like that. So if you see any of that, they're automatically out for that game. But without that, then you go in and do your evaluation. So basically, if myself and the neurologic person agree that they're fine, then they're able to go back into the game. If there's any doubt or question, we have to take them back into the locker room and do a more thorough evaluation where they go through about a 15-minute battery of testing that's all standardized, and they have baseline comparisons for that 15-minute assessment from the preseason, things like that.
And Byron, you said you travel with the team.
Yeah.
Because in hockey, I know in the playoffs I just read, they use in Boston, they would use the Boston physician,
Right.
especially probably nowadays. But in the playoffs, they would take their own physicians, because in the playoffs they don't want the Bruins doctor going, oh, he can't go back in.
Right.
You know, he's got to stay out for a while, and that could lead to all kinds of problems. But you say you guys travel with the team all the time. Okay. The other thing,
like that,
I wanted you to kind of get into, if you could, take us through the year, the momentum building, the excitement building,
sure,
the you know, in your feelings, you know, when you said, geez, we can win this thing. You just do the Super Bowl win.
Well, I think it was pretty neat when they added Brady, obviously, someone of his stature and in history. You know, anytime somebody's just that good at what they do, it's neat to watch them do what they do, you know. And so even starting in camp, I remember going to, you know, part of my job too is I cover like a week of camp when they're first starting, basically there to help with any kind of heat illness issues or concussions. But it gives me a chance to just stand around and watch practice and hopefully not have to work at all, right? That'd be nice. And I remember watching Brady during those first few sessions, and it's impressive. I mean, he's very consistent with what he does. You know, he's very, you know, detail oriented, very demanding. So you could see him immediately trying to get guys to be very specific about what they do with their routes or where to expect the ball to be. And that all started from like day one. And so as that progressed over the first couple months of the season, you could see, I mean, the guys expected a lot of themselves, but football is such an execution sport. And a lot of our guys were brand new with each other. They were still building that chemistry for them to execute. And I'm no football coach, but I like to watch it. You kind of see it in general happening. But I think having like their first road game in New Orleans against Drew Brees and a Saints team that had a lot of people coming back from the year before, where they already had a lot of chemistry built up. We had no preseason games or anything like that. So it was really our first time competing against anybody, was against that team. And you could see, I mean, the guys were already kind of very frustrated that they weren't able to execute at the level that they wanted to. But one thing I always appreciated about Brady was he was never the guy that was trying to like lead kind of like the rah-rah part of it. You know, he was never trying to bring the guys up in the locker room before they'd go out to the game. He was just kind of one of the group, and he would let usually either Devin White or Levante David do a lot of like the locker room speech or whatever they were going to say to each other before they went out onto the field. But once the game had started, Brady would just sort of do his thing, but occasionally he'd get up and start getting on people because, again, he knows exactly the level of execution that's needed to be successful. And so that basically, progressed over the course of the season, where they had like really good games and some really bad games where they really had a hard time putting those pieces together. Then obviously by the end of the year, really coming off that bye week was huge. Going into the bye week, they suffered a bunch of losses in a row. They gotten beaten badly by the Saints, had back-to-back close losses to the Rams and the Chiefs, and then they kind of went into that bye week kind of licking their wounds a little bit. But it was really the first time that they had to really kind of reset and get going. And obviously they were a different team at that point, and went on to be really successful.
So, again, tell us how you felt, your emotions that led the playoffs, and then
Oh, sure. So for me, the playoffs. So part of this I mentioned earlier before we got into some of the details. Like my family had COVID right around Christmas time in December, and so I was stuck quarantining for about a week in order to get cleared to come back to work. So I was very close to not even being able to go to that first playoff game in Washington. So I missed the last 2 games of the regular season because of being on quarantine. And then once we got into the playoffs, I was just kind of happy to be back because I really didn't want to miss out, on the experience and things like that. But also kind of curious because I've never been to the playoffs with an NFL team before. I didn't really know what to expect. And what impressed me a lot with the guys is their demeanor really didn't change much, in terms of how they were going about preparation. They were very consistent in the course of it. And that made it easier for me. I really wasn't getting bombarded with a bunch of new requests. Everybody was in a pretty stable routine. You kind of knew what they were going to be asking you for and what their concerns were. And so once the game starts, it's something where you're kind of in work mode, and you're watching the plays and you're checking on guys and you're doing whatever comes up during the game. You're just kind of focused on that. And sometimes if you're attending to a player in the locker room, you'll miss like a quarter or half a quarter or some amount of time of the game. And so sometimes it's a little bit disjointed. But I remember, being on the sideline and just watching the guys go, and they were staying in the games and then kind of getting ahead. And then you'd get to the point, usually like 5 minutes or so left in the game, you're like, okay, we've got a chance to win this. And it kind of dawns on you because you get so caught up doing your job. It's not like being a fan in the stands where you're really, really kind of there seeing it from that perspective. You kind of get lost in what you're doing, and then all of a sudden it's the fourth quarter and there's a few minutes left and you say, oh, okay, like we're going to win. And that obviously makes you happy. A winning locker room is a lot of fun compared to a losing one.
Matt, at a point, after the game, after we won, I went online and I ordered a flag to hang outside my garage. Mm-hmm. And the company was obviously from China or Taiwan or something. And so one day I get my flag and I open it up. And this is what I got.
No.
So, the wrong way.
Oh, it says champs too.
Yeah,
oh, wow.
So
nice.
I emailed them and I said, sheesh, you sent me the wrong, so they're going to send me the right one. But I'm just wondering what the hell I'm going to get for this on eBay, right?
Oh, yeah, that's got to be a collector's item.
I know, right?
Yeah. Yeah, as far as the Super Bowl goes, I mean, that was a whole different experience, obviously. I think what's different about it is even though we were in our home stadium, the league kind of takes over all of it. And so everything looks different. Even the tunnels underneath, inside the stadium, they hung lights, all up and down. Everything was brighter. I mean, it was quite literally like you're under the the bright lights of the Super Bowl kind of wherever you go. But the routine was pretty much the same. The big monkey wrench I had to deal with on the Super Bowl was the EMT guy that I talked about before that helps us out so much. He comes down, I get a phone call from him at 8 in the morning from his hotel room, and I go in there to look at him, and he's got appendicitis the morning of the Super Bowl. And so obviously we were in a little bit of a scramble, but I was kind of in the mode of, all right, I'm going to have to take care of all these IVs, and I know I'm not going to be able to do it as good as he does it, right? But I've just got to go get everything set up. So I went even earlier. I had to go with the early bus down there to get everything set up since he was out. I was there, I think I got there at noon to the stadium from the team hotel and got everything set up. But the EMT, God bless him, he somehow convinced the ER doctor to just give him an infusion of Zosyn and send him on his way, and he'd come back after the game to have his surgery.
No kidding.
They agreed to that.
Wow.
He came in, and I said, if you rupture on this sideline, I'm going to be so mad at you. But he somehow left the ER, with his IV in, after getting a dose of Zosyn and like a couple liters of fluid. And so the whole pregame, I'm having to work with the players and the EMTs putting in their IVs, and I'm having him just sit. I said, just sit here, just put in the IVs and just sit. I said, I'll do all the running around. And so I did all that. And at the meantime, I'm hooking him up to IVs like every hour, giving him like a liter of fluids because he's NPO until his surgery after the game and stuff like that. So that was pretty comical before the game. Questionable medicine maybe, but we got him through.
How did your wife and kids adapt to your lifestyle routine changing?
Yeah, I'm blessed to have a wife that loves sports, so that helps a lot. She's used to me having to travel a lot because of what I've done at the university for a number of years, but this year was just way more than what I would normally have to do with them. So they're very supportive. My kids are still young. My son's 7, my daughter's 3, and my 7-year-old's like kind of aware of what I do. My daughter's like all about it, being a 3-year-old. She seems to really love football. If she sees the Buccaneers on TV, she stops and tries to look for me. Although I'm pretty convinced she thinks I'm a football player, and I try to explain to her that Daddy is not a football player. Like, I take care of the football players. I was like, if you met a football player, you would understand Daddy is not a football player. So.
Byron, I have a question about opiates. These guys get beat up. They're in pain a lot. I'm sure they get prescribed Percocet, whatever. Are they allowed to play with opiates on board? Can they take them? Do they take them? I've always wondered because these guys get hit so hard. I'm thinking, well, maybe he had 2 Percocets an hour ago.
Right. No, they don't play with that on game day. And that was something I was curious myself about this year, just to see how much of that, was going on. But I was pretty pleasantly surprised that, guys would be prescribed them like post-surgery, obviously, for short duration. And typically that was it. Really not anybody, to my knowledge, using opiates on any kind of a chronic basis or anything like that. And most of the players, I think increasingly so, especially the younger players, are very skeptical of any medicines whatsoever. I mean, I've had some players, I can't even convince them to take like a leave, because they don't want to take the anti-inflammatory. So a lot of them, it's funny, like they're very apprehensive about pretty low risk medical treatments, but a lot of them are very quick they buy into a lot of the kind of, I guess you'd say, like holistic approaches to things. A lot of them have what they describe as naturopathic physicians that they follow in the off season. And that's something I'm still trying to figure out how to navigate, because I may have, I have, some players that may have like a medical problem that needs to be addressed, like high blood pressure or like a worsening kidney function over time. And I'm trying to make recommendations that they do this and that assessment, and the responses I get are, no, I'm going to be working with my naturopath. I'll get back to you. And I'm like, okay. So there's a lot of that there. I don't know why, but they seem to be very vulnerable to sort of that world of kind of not very evidence-based medicine, and these people that call themselves physicians that go to, I don't know what school you go to be a naturopath, but obviously they're not MDs. And
Do you have a higher power for you to go to and say, listen, this guy needs medical treatment, not herbs?
yeah, it's a challenge. During season, I can make recommendations and kind of at least get pressure on them to get things done. But really, once the season's over and they go off to their home states, like they can do whatever they want, and at any point they're entitled to get a second opinion from anybody on anything. But in these cases, that's something I'm still trying to learn how to navigate in a successful way, to where you can sort of, because just telling them like not to do it or that you don't think it's a good idea usually doesn't get you anywhere. You kind of have to find a way to meet them in the middle on what they want to do and things like that. And so they seem to be much more comfortable with supplements, and there's a lot of pushing probiotic stuff, and you guys have probably seen a lot of these naturopathic doctors. They'll order these like gut flora labs that you get these reports. I'm like, I don't know what any of this means, right? But there's usually some product that they have in their office that's perfect for whatever the lab abnormality shows, right? So,
Byron, I clipped something out of the paper a while back to ask you about. It was an article about Shaquille Barrett.
mm-hmm.
And says he grew up in Baltimore, was sent to Boys Town, Nebraska, where he was an all-time player. He signed with the Broncos. As a free agent, only 2 teams had an interest in signing him. He failed a physical with the Bengals before signing a 1-year contract with the Bucs.
Mm-hmm.
What kind of physical do you fail that a team goes ahead and hires you?
Think about that? Again, I wasn't there at that time, but I would think that's probably something orthopedic, where each team will have their own opinion on it, to where one team surgeon may look at something and say, no, this is likely to be a problem. And another team may look at it and say, no, we can work with that. Or our doctors are comfortable with this or that. A good example would be what you saw happen with Tua from Alabama last year in the draft. There was a bunch of teams that had him graded as an F. They're like, don't touch him. He's had all these injuries. Obviously had a hip dislocation and a bunch of ankle and knee injuries. But obviously the Dolphins felt comfortable with what that was, right? So a lot of teams failed him on his combine physical, but the Dolphins didn't. And so they went along with it.
Are you the youngest NFL physician?
That's a good question. I don't know. Maybe. I'm 35, be 36 in June. And I know the requirements for the job are you either have to have a sports medicine certification or so many years like working with a team if you don't have a sports medicine certification. So I don't know if there's anybody younger or not that's doing it. I don't know, with the head job, maybe that might be the case.
Do you have any players that were your favorite to work with? Did you have much contact with Brady or Gronkowski? Or
yeah,
he says he's a riot, but are any guys who were really difficult to work with?
Right. So that was one thing I was curious going in was, all right, how many are these guys going to be like divas or prima donnas, or what's going to be the difference going from college to professional? And I'll tell you, to be honest, I was pleasantly surprised. A lot of the guys are just very good people. They're pretty easy to work with. They're understanding. I think a lot of that comes from the athletic training staff there. It's Bobby Slater's the head athletic trainer, and he really sets a good tone for the athletic training room, which is where all the medical care is given. And so people there, I think everybody's very respectful and of everybody's time and expertise and things like that. And so really nobody that was a bad experience. The one I was probably worried the most about was Antonio Brown, just obviously with his, what I knew about him in the papers and things like that. But again, once you meet people in person, you realize they're just normal people. They just have interesting jobs, and that was the case for the most part. I think Gronkowski, I mean, he's exactly what he looks like. He interacts the same in a casual, like in-person encounter as he does any place else. Brady's obviously unique. I mean, he's so well known. The big challenge with Brady is just getting his medical needs taken care of without dealing with a HIPAA violation, and that takes a lot of effort to do that, to get him in and out of places or things like that without people known, just because he's probably one of the most famous athletes in the world. It's just difficult to do. But luckily, I think people kind of step up to the plate and help you with that when you need it.
Anybody else have any questions?
Rodolfo.
Go ahead.
This is a general question. I played rugby football for 16 years, and I often wondered whether the quote-unquote protective equipment in football injures more people than it helps.
It's a good question. There's pretty good research that anytime you add a piece of protective equipment to a sport, the injury rate in that sport goes up just in general. But usually you're adding the equipment to get rid of like a specific bad injury, right? So even like the origin of helmets in football came from the fact that they had a lot of skull fractures, brain bleeds, and even deaths on the field. And I think it was Teddy Roosevelt was the president at the time, was really the one that stepped in and encouraged a safety committee to be developed for football that kind of spurred a lot of that stuff on, and in a lot of ways saved the sport, because a lot of people were wanting to ban it or outlaw it at the time.
I really don't understand that, because rugby football is played without helmets. And as I said, I played it for 16 years, and all I have on my head is a scar over an eyebrow. Mm-hmm. And I fractured my nose twice, and a helmet wouldn't have prevented that.
Yeah.
So I'm not sure that football players use the helmet as a battering ram.
Yeah, obviously the collisions are very different in American football compared to rugby. And there's a lot of comparisons drawn between the sports, but I think just the movements on the field are different. The speed of the collisions are different. And that's one thing you notice, like when you get on a sideline, with an NFL team, is these people are so fast. They close in so quickly, and they're so big at the same time. I mean, it just.
I'll tell you, I got the, if anybody hasn't gotten it yet, or if you have a chance to buy it, I bought the NFL summary. I guess they were following the Bucs all year. Well, they follow every team. They film every team. But the video of the Bucs season and the playoffs and the Super Bowl is just a really good video. And they show highlights. I think Devin White, the last few games, especially the playoffs, he was obviously, other than Brady, I mean, he was the second most valuable player. But the hits that they just showed a conglomeration of his hits. Oh my God. It's like Byron said, and Rodolfo, I think, I don't know much about rugby, but I've watched rugby. They just seem to pile on one another, and then somebody runs away with the ball, and then somebody grabs them and tackles them. They're not running it at 15 to 20 miles an hour, or I don't know, probably not that fast, but even 10 miles an hour on a short run and getting, hit. And they lower their helmet to hit with their shoulder, and the other guy turns his head, and obviously the helmet's hit. But if you get,
when you don't have a shoulder protective device, I am not going to hit an opposing player so hard that I would break my own clavicle. That's human instinct.
Right.
But rugby isn't a sport that they're running at one another. It's more of a, I don't know how to describe it, but they just seem to pile on everybody and then run away and then tackle somebody and pile on again. I mean, you could hurt yourself certainly, but as Byron said, I don't think the mechanics of the game are the same.
Yeah, there are different collisions. At the high school level, there's a lot of teaching of rugby-style tackling as a technique to try to, again, lower the occurrence of those head-to-head collisions. But, again, I think as you go up in level, the speed increases so much to where the tackling evolves.
Anybody else have any, Steve? Steve, you're unmute yourself.
Okay, can you hear me?
Yeah.
Can you talk about the head injuries and the traumatic brain injuries and how you deal with that on the field? How do you determine when to take somebody out? How long do they end up staying out?
Right.
I had 2 family members with traumatic head injuries, and one was out for 6 weeks in a dark room, another for 2 weeks.
Yeah, so on the sideline, we kind of go through an evaluation where you're, number one, you're talking to the player to see how they feel, but you're always understanding that they're more likely to lie to you than they are to be honest with you about how they're feeling if they want to go back in. And then you put them through some neurologic assessments where you're looking for disorientation, cranial nerve changes, difficulty with visual tracking is really common. And then obviously any kind of focal neurodeficits, memory problems, things like that, balance changes. And so at the NFL, it's done by both the decision with me and the independent neurologic consultant that's there. And so once we diagnose the concussion, then they're out for that game. And they basically have to be reevaluated daily after that. And they go through kind of a progressive increase in their physical activity as their symptoms improve. And they're not cleared to go back until they go all the way through that progression with no symptoms. They have to test back to their baseline level on their pre-injury assessments. And they have to get cleared by me and the independent neurologic person before they go back to competition. And so really, I mean, once you diagnose the concussion, the quickest somebody can get back is really about 5 days. And that would be if they had like really rapid resolution of symptoms in the first 24 to 48 hours. Most injuries, guys are out about 2 weeks before they really work their way back. But sport-related in general, the typical recovery time ranges from anywhere from 1 to 4 weeks. And so there's a lot of factors that can play into how long there are people that are higher risk to have it go longer, like if they've had a higher number of complex head injuries before, pre-existing ADHD or anxiety or depression or migraines tend to cause longer recoveries, things like that.
There's been a lot of discussion in the last few years about chronic TBI. Going ahead with Steve's question and taking it to the next level, what do you recommend to players or other, for that matter, patients with chronic TBI symptoms who are functional but still symptomatic? Is there a national center? I've heard of places in Atlanta and Boston and Chicago, for example, where you refer people for complicated, complex care for not people that are incapacitated but are still symptomatic. And is there like a lead place in the country you go to?
I think for a lot of like the CTE research, there's like a lot of that going on in Boston, but that's a lot of that sort of post-mortem research where they have like their brain bank and things like that there. In terms of people with active concerns, I think the biggest thing I tell them is just report their symptoms so they can be looked at. And we do a fair amount of that here at the Concussion Center, where people come in and they have kind of longer term concerns. Maybe it was sport related. I've had a couple of retired like WWE wrestlers come through, people with car accidents that have had long-term symptoms. And it's complicated. There's a lot of things that go into it that you have to look at. But in terms of like a leading like rehab center or something like that, I'm not aware of any place that's like known as like the place to send somebody that you're concerned about CTE, although people may have different opinions on it. It's probably going to center around most big academic medical centers, I would imagine.
Aaron, did you have a question?
Yes, thanks. I have seen just briefly some reports that some of the players have challenged, some of the retired players have challenged definition of brain injury based on what they claim are different standards for white and for black players. Is there, have you heard about anything like that, or is that true that black and white players are judged differently?
I've heard about this disparity being brought up. I think a lot of that centers around the NFL has a program for retired players where they can go and be evaluated for any kind of long-term concerns. And I think it had something to do with the neuropsych assessments and the different kind of race factors that can go into those assessments. I think for like age-matched normals and things like that. I think it has something to do with that, but I'm not directly involved with those programs. It's interesting, like you can't, as a sports medicine doctor, I'm not allowed to evaluate those retired players. You have to be a neurologist to do it, which is very curious because most neurologists don't do anything with concussions, you know? And so I find it kind of funny. So I've offered to help with that program, but they said, no, you're not a neurologist and can't do it. So I don't have an intimate knowledge of it, but I think it's something to do with the neuropsych evaluation that they're not happy about.
Anybody else? It's almost 1 o'clock. I was going to let Byron go, and we can hang around and just for a few more minutes. Bob Isbell came in a little late. Good to see you, Bob. And Steve came in a little late, but
yeah, one thing I'll leave you guys with before we wrap up, probably the neatest thing I saw over the course of the season was at the Super Bowl. And I made a comment early on where Brady was never really the guy like leading the charge as they go out of the locker room or things like that. That changed during the Super Bowl. That was the first time all year where I saw him kind of rally the guys up after Coach Arians talked to him. And he kind of pulled everybody up into a tight group and gave a very passionate speech about the game. And he kind of focused on the topic of honor and kind of the honor that would come from winning this game and things like that. And it was very good. I mean, it was one of those speeches where you could kind of feel it when you're sitting there and watching it. And when he gave that speech, I remember turning around to go back to my little work area going, wow, that was pretty cool. And I think it made an impact. So I think after the game, I think Leonard Fournette did an interview where he kind of credited that speech for all, a lot of their enthusiasm coming out and stuff like that. It was pretty neat. I think especially because it never happened all year. That was the only game that he did that.
I'm sure all of us at one point after the game said, that's pretty cool. So and I assume, I would hope that you're going to get a ring. And when you do, I want you to invite me over to take a picture of it so we can put it on the cover of the bulletin.
Right, there you go. Yeah, I'd love to get one. I hope to.
You think you're going to get one?
I mean,
you should.
I hope. I don't have it in my possession, so I don't know.
Well, they don't come out for a while. I mean, they gotta.
It takes a while.
Figure out how many diamonds to put in there and everything else.
I think we do. I just, I don't think it's in my contract that I get a ring if they win or anything like that. So, if the team's goodwill sends one my way, I will accept it.
Very good. Well, I want to thank you on behalf of all of us for taking an hour out to come speak to us. It was very enjoyable and gave us some insight on what goes on the field.
It was great talking with you guys. Happy to reach out anytime if you ever have any questions or anything.
Okay, Byron, thanks.
All right, take care.
Thank you.
Bye.